So in this section, I wanted to go over some frequently asked questions that I get in clinic from my patients. I get a lot of questions. Why are you asking me about my calcium intake? You just did a blood test and my serum calcium was normal. Isn't that a good representation of my calcium intake? Well, the short answer is no. Your body, under normal circumstances, will do everything it can to maintain a normal serum calcium. So if you're not getting enough calcium from your diet or supplements, then you are going to be losing more calcium from your bones to maintain a normal serum calcium. So that's why we always talk about adequate calcium intake. On the opposite side, if you're taking too much calcium, you will lose that calcium in the urine and you will increase your risk of having kidney stones. So please make sure to discuss with your doctor how much calcium you should be taking on a daily basis. It's usually about 1,000 to 1,200 milligrams of calcium a day, but in certain instances you might need to be taking more calcium if you're having problems with absorption, or less calcium if you've had problems with kidney stones. A very commonly asked question is, will my bone density ever improve, or this is it? Well, yes, your bone mineral density can improve with therapy. It can improve more so with some agents than others. However, stabilization of your bone mineral density or lack of significant decline in your bone mineral density, which is something that we expect with age, is a treatment success. And that has been shown to be associated with decrease in risk of fractures. If I am on osteoporosis medication, do I still need to take calcium, vitamin D, and exercise? Absolutely. I think about calcium and vitamin D as being the building blocks, and the medications only work if you're taking enough calcium and vitamin D. In addition, we appreciate that osteoporosis is multifactorial. And so when we're trying to address osteoporosis and decreasing your risk of fractures, we have to take it with a multifaceted approach. So we do have to always talk about nutrition, calcium, vitamin D, exercise, fall prevention, avoiding things that could negatively affect your bone quality like smoking, excessive alcohol, and caffeine intake. Everything has to be in moderation, so excessive calcium supplementation is not recommended because that can increase risk of kidney stones. And heavy lifting or high impact exercises can sometimes cause injury. Another commonly asked question is, will carbonated or sparkling water negatively affect my bone quality? Well, the data on carbonated beverages is really based on the dark carbonated beverages like Coca-Cola or sodas that have high phosphates in them and that can affect the absorption of calcium. As of now, we don't have any data to suggest that sparkling water or seltzer can negatively affect your bone quality. If I exercise, will my bone density improve? Well, it might, especially if you are very sedentary at baseline. However, it's very unlikely that it will be enough to treat your osteoporosis. When we're prescribing medications for osteoporosis, we want to prescribe something that we know can decrease your risk of breaking bones, not just improve your bone density. And exercise works really well in conjunction to medications. Will my hip or back pain improve with osteoporosis treatment? And sadly, the answer here is no. Osteoporosis is a silent disease and does not cause any pain. And we don't expect that your pain will improve with osteoporosis medications. Osteoporosis medications can decrease your risk of having fractures, and that could decrease your risk of having future fractures and future pain, but it will not help you with your current pain. Talk to your primary care doctor about the cause and discuss treatment for your pain. Do I have to be on osteoporosis medications for the rest of my life? Usually not. Usually medications, we give them for courses, so bisphosphonates are usually given for 3 to 5 years. Some of the daily injections are given for 2 years. The monthly injections are given for 1 year, and the infusions are usually 3 years. Denosumab, which is Prolia, it's given every 6 months, and the duration of that is yet to be determined. But we usually do not recommend medications lifelong. But that doesn't mean that we're not addressing your osteoporosis at every visit. And we're not discussing ways to decrease your risk of having a fracture at every visit. And that doesn't mean that we don't talk about fall prevention with every visit. So lifestyle changes, nutrition, calcium, vitamin D, exercise, and fall prevention is an intervention that you will have to continue to do for the rest of your life. But medications, we give you courses of medications, and then we give you drug holidays, and then we can restart medications in the future. Thank you for your attention, and I'm hopeful I was able to answer some of your questions.